Why don't we go way in the back, if there's anyone way in the back, it's a little hard to see. Yeah.
On your right, sir.
All right, I want to thank you, Meg, for showing up here. This is a very important thing for me. We have two organizations speaking for the blind. Actually, I'm the blind speaking for myself, and I represent the California Council of Blind. And I had a couple of questions with you, for you. I also asked the people to give you a paper. I want to try to summarize my questions. Number one, with regard to crimes legislation, what would you do as governor for people with disabilities with regard to cutting down crime? Because this is very, very important. Last year in Sacramento, there was a lady who was on a bus stop, and she was attacked for absolutely no reason, and she ended up having to face her attacker, and her attacker just absolutely denied everything. And crime on the streets of Los Angeles is very, very terrible, so much to the fact that some of us who are blind or visually impaired, we really, really have to be very careful about that. And the last part, we really need people to be literate in Braille. And at the same time, we want to know what your commitment will be to make sure that people in this state will be literate by kindergarten, because this is a problem that must be stopped.
Good. So two questions there. The first is around law enforcement and stopping crime in California. So my view on this is the very first and most important job of government, city government, county government, and state government, is public safety. If people don't feel safe in their homes, they don't feel safe on public transport, they don't feel safe in their schools, then we don't start with the absolutely necessary but not sufficient condition to creating a great place to live. So I have not been in favor of early release of prisoners. I think this is completely the wrong thing to do. And I'm not in favor of changing sentencing guidelines. One of the great things about California in the last 10 years is we have reduced the rate of violent crime. We cannot let up on this. I also happen to be a big supporter of 3 strikes and you're out. So we have got to fully fund public safety. And this comes back to prioritization, right? This comes back to what are you going to fund, how are you going to do it most efficiently, and can we create capacity to invest in the things we care about by running things far more efficiently? I think we can. So I have a commitment to, really the #1 commitment is to public safety in California, and I think that will help people with disabilities, average citizens, moms, teachers, educators. Gosh, look what happened in Alabama the other day. I mean, it is just tragic. So that's first and foremost. Second, I don't know enough about your Braille initiative, and so I would like to learn more about it. My first reaction is, gee, I don't know that it makes sense, unless I'm missing something, that for everyone to learn Braille. I do think we have to be, very thoughtful about individuals with disabilities and how we make it possible for you to navigate in a seeing world. And I'll tell you, I have some personal experience with this. One of the things you may not know about eBay is because eBay was a level playing field where your next door neighbor had an equal chance of success to a large corporation. In fact, we had a much higher percentage of disabled sellers on eBay than in the general population. Because think about it, on eBay, no one knows whether you're disabled. No one knows anything about you except for how good your customer service is, how well your product is displayed, and whether you provide shipping on time and things like that. And at the very first eBay Live, which was every year, eBay had a gathering, a land-based gathering of eBay users. It was a virtual community, but once a year, about 15,000 eBayers came together. And we had a gala on Saturday night to honor all the eBay sellers and buyers. And that first year, we had people with disabilities line up to come through into the gala. And for really 10 minutes entering the gala affair was people with disabilities. And it was remarkable. And I'll tell you a little story that brought it home to me. I got an email from a woman at the next eBay Live who said, I'd like to introduce you to my son. He's an eBay seller. Will you meet him after your opening speech? I said, of course. Come back to the green room. Love to meet him. So in walks a mom and a dad and a 17-year-old son who had pretty bad cerebral palsy. And his mother said, I want you to meet my son. He is an eBay seller. I have quit my job to help him sell on eBay. My husband has quit his job to sell on eBay, and eBay is supporting our entire family. We just bought a new van for our son. We've got disabled ramps into our house. And I said, that is fantastic. What a remarkable story. And then she looked at me and she said, but you know what eBay has really meant to our family? On eBay, my son is not disabled. Yeah, why don't we go up there?
Thank you very much. My husband is a doctor, and I just Googled one day what's the average cost for a doctor to run a business at work, and he comes home in California. It's $140,000.
Wow, with tuition and all that?
No, I'm talking about running a business on an annual basis.
Ah, okay.
Because people don't realize they're paying rent, an x-ray machine costs such and such like that. I've been fighting hard against the health care bill. And, one of my suggestions is, instead of someone who has a headache going over here to the hospital emergency room, why not have a facility right next door that's non-emergency? And we have 2 evaluators here. If your child has a toothache, we don't pay emergency doctor fees. We send them right next door to a clinic where maybe interns are, or other people who don't have to be paid emergency fees. I think that would save our whole nation a lot of money. So not to come to an emergency room or be evaluated at the emergency room. We don't want to put a heart attack patient over here while we treat a little two stitches. Thank you.
Good question. So I am not at all for the healthcare proposals that are coming out of Washington. This is too expensive, and it will not deliver the results that I think are being portrayed. So here's a few observations I have about healthcare. And again, I want to come back to those 3 priorities of jobs and spending and education. Healthcare will be on the agenda, but it will not be the very first thing we tackle. But here's the observations I have about healthcare, and you're exactly right. When I think about healthcare, I think about a triangle. I think there's really 3 things that drive healthcare in the United States and in California. First is access, who has access to healthcare, and then it's quality, and then it's cost. And if you don't work on all 3 of those things at once, then you end up with a big problem. And what happens is most politicians want to run to access without working on cost and quality. And what you're talking about is working on cost and quality. How do you have higher quality results for the child with the earache and lower costs for the parents and for the system? And my view is unless we work on all 3 of those at once, then we won't end up with the desired result.